Earlier this year, I've joined the SIOG task force on quality of life in older cancer patients. So it's a pretty international group, and what we've been working on since the beginning of the year is a paper, sort of a position paper, where we want to look at quality of life assessment in those patients, and that's a group of patients, promote. It's mainly to raise awareness, actually, and we want hopefully to promote that assessment and even implement in some units that aren't currently doing it. So when you look at older patients, we've been seeing that the majority of them are actually older cancer patients, and age itself, we're not expecting the age itself to impact or to decrease the quality of life. It may impact because at least the age-associated changes will change the perception of quality of life in older patients when we compare with younger. So, in a lot of times as physicians, we tend to assume that we know what is the best for patient, what is in their best interest. Sometimes we don't. And sometimes we have difficult cases where we think, well, I don't really know what is best for the patient. So getting that assessment could help us find the best pathway for that patient. And to do the quality of life assessment, the main thing is that we'll need to explore what are the fears of the patients, their expectations, their needs, their preferences. And by doing that, we can identify some unmet needs. We can personalize the treatment, and hopefully, after all of this, we can actually get better cancer care. It is my experience, but I think that's something that we experience in a lot of hospitals. We don't have a lot of time. Our focus throughout training is always, well, let's assess the patient, what is the best treatment for them. And we've improved quite a lot assessing how fit is the patient for a specific treatment. But then assessing what does the patient really wants or other unmet needs in the middle of this process. Sometimes they are sort of plan B in the middle of all of this. So I think we should definitely improve in that communication and assessing those needs, because every patient will be different, and I think the main thing is we need to align our goals as physicians with the goals of the patient. I think everyone should be involved. It wouldn't be just the physicians, definitely agree. It would involve nurses, patient advocates. It is a team effort, and definitely we should improve on that. By bringing that idea into the head of some colleagues, and a lot of the times I think the fear is time, because, well, we're doing all of this, we don't have that much time, so if we go into those detailed discussions, maybe we will lose some time. And I think it's probably the other way around, because if you have those discussions right in the beginning, and even throughout the process, that will save you time, because you can not just understand better your patient and their needs, but adjust the treatment and the plan for that specific patient. So that would actually probably save you time and even resources later on.